Hello everybody, this is Brock McKeown. The telemedicine program that I created is called Mobile Recuperation. Mobile Recuperation is an online physical therapy telehealth program. Physical therapy can benefit greatly from telemedicine. After an injury or surgery, it's common for a physician to determine the need for physical therapy. Um, they'll be able to write the referral and send the patient to a physical therapist. And with mobile recuperation, um, the patient will be able to meet with the therapist over the computer. Um, Mobile recuperation provides our community with the best patient care and has an obligation to use innovative solutions to fulfill our commitment. After the patient receives surgery, they must start the major recovery process in which they can be physically fit um, and or be able to function in their body. And if a patient decides to use mobile recuperation from their home, it's necessary for a physical therapist to make a home visit for an evaluation. Um, they'll be able to see what must be done to help the patient, and they'll be able to see what major tools and equipment the patient will need in order to be fully assisted in the best way possible. Um, they'll be able to see how major the injury is, and the therapist will also be able to install special cameras throughout the room. Um, they'll only be able to access these cameras when it's time for an appointment. The next slide we'll cover is going over goals and objectives. And so the first goal is that we must implement realistic goals as a company. Developing a telehealth program based on clear goals and objectives follows for the highest level of success in meeting the organization and the patient's needs. And it's important to document where we are now and where they'll want to be in the next 3, 6, and 9 months. Also, people are uncertain how to embrace new technology, but if it implemented correctly, therapists will find that telerehab can maximize the power of innovation for virtual care, and this will allow them to give patients the care that they need and when they need it, while also allowing clinicians insight to what the patient is doing away from the clinic. The next goal is that physical therapists, as physical therapists, they want to improve the access to physical therapy. Therapists are always very busy, and patients are scheduled back to back for sessions and sometimes booked for months in advance. And so telerehab will improve access to patients in distant locations. The next goal is that physical therapists are taught to focus on the patient's individual goals, and they'll ask the patient what their goals are and what they want to do to be fully mobile and to reach those goals. And we must make sure that they do their exercises correctly. And if we can use remote monitoring and telerehab technology, we'll be able to reach beyond clinic setting and into the patient's homes. The last goal is that we want to reduce or contain the cost of healthcare. Reducing or containing the cost of healthcare is one of the most important reasons for funding and adopting telehealth technologies, and telemedicine has been known to reduce the cost of healthcare and increase efficiency through shared health professional staffing, reduced travel times, and fewer or shorter hospital stays. Next slide that we'll cover is the revenue model and the deployment costs of mobile telehealth and the reimbursement of services provided over this network remain two major impediments to rapid deployment for mobile recuperation. Most of the technology costs and the consultations that are carried out through telemedicine are not reimbursed. And so one of the key challenges impeding widespread deployment of telehealth services includes developing an appropriate pricing plan. But given the potentially high capital cost of deploying a national telehealth network, reasonable pricing can be achieved if costs are covered all stakeholders on society, including the government and corporations. We also have a services plan, and almost every medical specialty can provide services through telehealth, and the services plan refers to the care services to be offered using telehealth methods. For reimbursement, an organization that wants to deliver clinical services through telehealth is always concerned about reimbursement. And these are three third-party reimbursement categories, which is Medicare, Medicaid, and commercial insurance. The next slide we'll cover is the telemedicine software. Choosing which telemedicine software was very difficult, and there seems to be so many different programs to choose from that would meet my needs for physical therapy. Ultimately, the software that I chose was Physio. It's a physical therapy telehealth software that extends traditional practice online. The therapist can monitor multiple patients remotely to ensure that they are using proper form, and then interfaces are very easy to navigate and understand. Another thing that I really liked about it was that it is accredited by the APTC, which is the American Physical Therapy Association, and it is also HIPAA compliant. As far as the next slide, we'll go over medical licensure, legal issues, policy, and technical guidelines. Physical therapy providers delivering care using technology must be authorized by law to provide physical therapy services in the state in which the client is physically located during the interaction and services. This originating site or client site is the location where physical therapy care occurs, and the client site may change if the client's physical location changes between initial and subsequent treatments. And the provider must also be licensed in the jurisdiction where the client is located and must adhere to laws defining scope and practices in that jurisdiction. For legal issues, privacy and security of client records is vital. For physical therapy or any healthcare practice in that matter, it's important that proper steps are taken to ensure compliance with all relevant laws, regulation, and codes for confidentiality and integrity of identifiable clinic or client health information. Providers must comply with federal and state legal standards of medical information privacy. This includes HIPAA, HITECH, and the Affordable Care Act, and state privacy, confidentiality, security, and medical retention rules. For informed consent, it's important that physical therapists must follow state law requirements and professional best practices for acquiring informed consent for in-person encounters. Clients should be made aware of any limitations that telehealth services present as compared to an in-person encounter for that client situation. This includes the inability to perform a hands-on examination, assessment, and treatment. For policy, we have standards of care. Physical therapists' responsibilities are to ensure the standards of care required both professionally and legally per practice is met. It's mandatory for the physical therapist to determine which clients and therapeutic interventions are appropriate for the utilization of technology as a component. For technical guidelines, physical therapy providers need to have the level of understanding of the technology that ensures safe, effective delivery of care. Providers should be fully aware of the capabilities and limitations of the technology they intend to use, and that the equipment is sufficient to support the telehealth encounter. That is the end of the slide, and I appreciate you listening to me, and it's been a great, I've had a great time with this class, and good luck to everybody. Thanks.